Dr. Ashley Andersen, take one. I know, this is as close as I'm ever gonna get to the confession chair on Real Housewives. What am I supposed to say? I'm a physician at OBGYN West.
Dr. Andersen is the most healthy, disciplined person I've ever known. Even when I'm eating a cheeseburger, she refuses to do it too.
I'll be feeling pretty good about myself, and then Biggest will waltz in with his Wendy's. It smells so good. But he always gives me fries. Me becoming passionate about fitness really happened after the age of 30. And so that's something that I love to talk to patients about. I love to kind of share with them how I kind of found an exercise routine that didn't just feel like work, that it was something that I actually enjoy doing. It was important to me to work out throughout my pregnancy. So I was there doing a workout the day before I went into labor. And so a lot of them saw me working out with this big bump, and I think their first instinct was like, is that safe? But then they're like, oh wait, she's an OB. From that, I think some people saw me doing that, knowing that I was a doctor, and thought, I want to be able to do that while I'm pregnant. I want a doctor who supports that. And so, yeah, a lot of them have started to come to me as patients. And so now I see them at the gym, I see them in clinic, and it's super fun.
Her sitting down with patients and having an overall general conversation with them, just like she knew them and how much she knew about their life, and catching up with them and saying like, oh, how's your sister? How's your cousin?
In my day-to-day life, the way that I know that I'm doing a good job and the way that I feel good about what I'm doing is when a patient of mine is in labor and she needs to be delivered, and I knock on the labor room door and walk in and say, hi, and I see the way that her face lights up because I'm there to deliver her baby, that's how I feel fulfilled. I became a physician because of my dad. My dad is an amazing doctor. He is the most hardworking, caring person I've ever met. And his patients and his coworkers love him. Sometimes he missed things. He did critical care. He missed sports games because he was in the ICU. He missed holidays because he was rounding. It was okay because I knew that his patients needed him. Sometimes when I'm on call and I miss things, I hope that Odin knows that mom's not here because she's just not here. She's not here because she's taking care of other babies or taking care of people who really need her right now. And I just remember knowing that my dad was doing that when I was growing up, that that's what I wanted to do.
She is a hard worker, and she really puts patient care as one of her main priorities, and you can tell that when she comes to work.
I think that medicine is, in a lot of ways, it's an art as much as it is a science. And so that's one of the things that I think is really important to my practice, is that I use the knowledge that I have from my training as a physician to kind of tell me what treatment options there are and what things we could do. But then I kind of recognize that patients don't always follow a textbook. And so what's right for one person might not be right for another patient with the exact same thing going on. And so for me, coming up with a plan with a patient, it's about me using everything I've learned in my training and kind of presenting them with some facts and some options, but then really sitting down and having this in-depth discussion with them about them as a person and what would make a treatment plan work best for them.
She, to me, feels like an old soul in medicine. She does it the way the doctors did it when I started, and kind of the way I've tried to do my practice. She is about the patients, the practice. That is her driving force.
I chose OBGYN West because, ultimately it was the people. And I remember hearing that there were so many staff members at all levels who had been here for decades. There are a lot of people who have dedicated their whole careers to this clinic, and I think that speaks volumes about what we do here. People stick around here because we are doing good work. We're doing good things for patients. Our patients love us, and it's obvious. And I think when I came here and interviewed, I could see that, and that's what I want in a career. I can spend my entire career treating these patients that I'm meeting now who are teenagers going on birth control. If I could deliver a few babies for them in 10 years, help them get through menopause, see their daughters when they need their pap smears. I mean, that's why we do the job.